Okay, welcome back, everybody. This gets into the second part of this presentation, which has to do with a country application of the concept and methods of essential public health functions in Indonesia. As time passes, things change. I retired from WHO in 1999 and joined a U.S. nonprofit, Management Sciences for Health, who obviously works through USAID to support countries with specific tailored programs. As it happened, one of the first involvements that I joined was in Indonesia in a management and leadership program. And at that time, Indonesia was in the throes of decentralizing that huge country in order to allow their districts to foster health promotion and support, and to do so basically on their own, but they felt the need for a guiding framework to keep them focused on the priorities that were recognized at the national level. The opportunity, therefore, appeared to promote the concept of essential public health functions, which they ended up calling obligatory public health functions, for which they chose to set national targets and minimum service performance standards. The process that we went through with them was to engage at the same time with the central level and selected provinces and districts to explore what was going on at that time and where and how it might be improved. I cannot describe the details of the process, but they came out with their own list of obligatory public health functions for which they set targets and minimum standards, and that these standards were provided as guidance to the districts in the context of decentralization. Therefore, it was a mixture of central and subnational definition of their responsibilities. They had certain categories of functions, which are listed here. The basic health services, and particularly MCH, was one category, but there was nutrition, referral services, communicable disease control, environmental health, health promotion, and then they added prevention and management of narcotics and substance abuse. So you can see the national character of the categories of obligatory functions that they came up with in Indonesia. In breaking one of those categories down, we can find the obvious contents. The environmental health category includes water supply, sanitation, community markets and restaurants, inspecting food establishments, and vector control activities. Now, the work of the project did not stop at the point at which the standard categories and functions were defined, and in fact they were translated into a regulation which was extended throughout the country. But we also sought approaches for encouraging district level planners and staff to devise their own approach to implementing the standards, and further to undertake assessment of how well they are doing themselves in carrying these out. And this was in support of an activity that we were developing and applying in a number of countries, referred to as performance assessment and improvement. And you see pictures here of a team in central Java which was engaged in their assessment of their own performance of the essential functions. The result of this was that Indonesia developed and implemented the process for performance assessment improvement at district and municipality levels, and that they are able to show where they're making progress and where there may be gaps. The lessons learned from these two levels of involvement are poorly stated here, but I'd like to touch on them. The point is that some ideas come because of bureaucratic processes and political promotion and pursuit. Others seem to evolve because the time has come, and there is a requirement for embellishing and improving what should have been a routine services in all countries anyway. The second lesson learned is that changes in leadership obviously can result in shifting priorities. This is going on all the time, but for the technicians that are developing the approach, it sometimes causes setbacks. The product of all of this idea generation can take on various shapes and definitions and strategies, particularly for the implementation, first between organizations globally and then between organizations and countries. Essential public health functions must ultimately be assessed in terms of improved service performance and health and service improvement. The value in countries of supporting a concept such as this can only be realized if the decision and the definition of essential functions is promoted, but to my mind, left entirely to the governments to define in their own context and to implement. And this kind of raises another issue of sorts, in that how much promotion and support globally and regionally is necessary to convince countries that something may be of benefit, and then to allow them to take it over and own it. And my view, and I'm sure there are varying views, is that the more ownership occurs because of the maximum involvement of the public health leaders in that country to tailor it to their own situation. Thank you for listening to me.